I think we should start. We should start now. So, good evening, everyone, and welcome to this Open Innovator Knowledge Session, as we call it. So, before we get into today's topic, I want to pause on why these conversation matter. So, healthcare. We are talking about healthcare today. Healthcare is one of the few spaces where every decision has a direct human consequence. One insight, one diagnostic, one decision, one care pathway can change the direction of life, right? So, whenever technology enters this space, I personally, I've spent over 15 years in this tech space. So I can vouch for it. Whenever technology enters this space, it has to do more than just work. It has to earn trust, right? And that's exactly why today's session is important. We are looking at how generative AI and RAG, which is retrieval augmented generation, as we call it, are being used responsibly in healthcare. And not just to automate tasks, which is very basic, but to support clinicians, improve accuracy, and make care more personal, which is very important. And we'll discuss this during the discussion also. And so today's discussion is, not just about the buzzword AI. It's about what actually makes sense, what's practical, what's safe, and what's already making a difference in real clinical environments. And the best part about today's discussion is we are doing this session in collaboration with ProtoCare, an organization that has been working hands-on with hospitals, clinicians, and care providers to improve their patient journey using tech, smart tech. And now let's be honest, the healthcare system today is full of complexity, right? And we are working on a lot of healthcare use cases, and I've got a first-hand understanding of it. Clinicians have more data than ever nowadays, but less time than ever, right? Patients have expectations for personalizations, but the system isn't always designed for it. And you talk about medical decisions, these are getting more and more complex. So that's where Gen AI, especially our RAG, is starting to make meaningful difference. And today we'll hear real use cases. We'll hear real use cases from all our speakers, practical deployments, learnings, and the realities of bringing Gen AI into clinical environment responsibly. So once again, thank you for joining us. And with that, it's time to bring in the person who will guide us through today's conversation. Our moderator today is the very charming Suzette Ferreira, founder of ProtoCare, someone who has spent years at the intersection of clinical workflows and innovation, ensuring tech actually works for real patients. There you have it. Now we bring her on the screen. All right. You will notice something special about Suzette, right? This isn't just a fun visual. It's actually representing something very real, because in healthcare, as we say it famously here in India, the heroes aren't always the ones wearing capes. They are the ones who bridge gaps, connect people. And Suzette has been doing exactly that. So Suzette, please join me in welcoming Suzette and other speakers. Suzette, the founder of ProtoCare, our moderator for today's session. Suzette, over to you to introduce our speakers and kick off today's discussion.
Good day, everyone. Naman, thank you so much for the introductions. Also, thank you for hosting this with the Protocare Group, Open Innovator. You have been awesome in this journey, and I love doing this with you as a company and all the team members that have partaken this. So yes, I am a registered nurse myself. I have years of bedside experience, but I was fortunate enough in 2007 where I actually pivoted away from bedside nursing. And my specialty in nursing back then was pediatric cardiac ICU. And then I pivoted away to actual nursing informatics. And a team of from Philips Medical Systems came to train us. I worked for Ministry of National Guard in Saudi Arabia back then, and a team of German and from the Netherlands colleagues came to actually train us on how to do that transition from adopting from a paper to a paperless solution. And it was amazing. And I realized, hey, yeah, actually, I'm born for this. This is what I'm meant to do. And since then, I have been so privileged to actually just grew into becoming a health informatics expert. Wrote a nurse undergrad book about health information systems in nursing. And it's lovely to have this conversation with you today. So thank you so much. I don't know how much joined us and what is the total so far. I can see there's a lot of 4 pages of faces already. So everyone, welcome. And I do hope you're going to have a lovely session as we are going to have to bring it to you. So I'm going to start off with just a little bit of flow in regards to how we are going to tackle the session. So basically, yes, you have signed up for the discussion about harnessing generative AI and RAG in health tech. So basically looking for a safer, smarter, and a personalized care, addressing the real world impact of AI in healthcare. And a person on one of our LinkedIn posts said the reason why he loved it so much is due to the fact that we brought on international knowledge. And this is what we did. So I'm from Cape Town, and it's lovely midday at my side. We're in Naman and the Open Innovator side. It's night already there. So yes, we are bringing you really knowledge on an international level. And as Naman has said already, please bring your questions to the table and we're going to answer it for you. So I'm going to start off with asking my own set of questions to 4 well-esteemed and internationally known speakers.
So
So
we have
they
a
are
global panel today, Suzette, and we are very fortunate to have all our speakers today. If you could quickly, and I'll request our team to show all our speakers on the screen, please. And Suzette, over to you to quickly, introduce all our speakers, please.
okay. Perfect. So first and foremost, let me just see who you have added already. Oh, I love the superheroes. It's beautiful. So let's start off with Michael, Dr. Shandana, Dr. Ang, or Dr. Gary, as he liked to be known, and then Charles. So first and foremost, Michael is going to okay, let me actually give you their abstracts, and then you can we can work through that. So first and foremost, so Michael is Michael Davis, and he's actually a healthcare technology strategist and a current founder at Clarivantage. And he also is a former head of strategy at Invicta and the head of service innovation and R&D at Philips Medical Systems. He's currently based in Boston, United States. So Michael brings more than 2 decades of experience in healthcare technology, spanning Europe and the United States, where he has continuously shaped how patient monitoring and clinical information systems evolves from static tools into intelligent, human-centered ecosystems. So he began his career in Philips Medical Systems in Dusseldorf as a field service engineer before rising to lead the Service Innovation Center at Bublingham in Germany as a global hub for innovation, where he directed cross-functional teams in integrating predictive data solutions within the clinical environment. So his leadership gave birth to ISA, and this is where I actually met Michael as well. Patient Status Overview Dashboard, a visionary concept that transformed fragmented patient data into actionable insights for clinicians. So following this journey in Germany, Michael advanced to Senior Director of R&D for patient worn monitoring and wireless solutions in Andover, Massachusetts, where he continued driving innovation in connected care technologies. He later headed R&D, manufacturing, and program management offices during Philips strategy of its lifeline aging and caregiving business. So today, as we said, Michael is the founder of Clarivantage in the United States. So Michael advises healthcare and medtech companies on bridging the gap between strategic vision and operational execution. His firm delivers strategic advisory and hands-on consulting tailored for complexity, compliance, and growth. So Michael leadership philosophy is anchored in one truth. Innovation does not start in the lab. I completely agree with him. It starts in the field. His journey from engineering to executive strategy reflects a career devoted to empowering frontline team to innovate with purpose and to build AI-ready systems that protect patients and strengthens trust in care delivery. So, welcome, Michael, and I am honored. We're honored to have you, and we are looking forward to the answers that you're going to give us. So now next off is Dr. Shandana. I was also privileged enough to work with Dr. Shandana in Germany, in Philips, and amazing person. So he's also a physician and managing partner, currently a managing partner at Atternes Global Consulting. He was a former senior product manager at Philips Medical Systems. And as we spoke about being globally located, he is currently situated in Germany, Stuttgart. So Dr. Shandana brings a rare dual perspective to healthcare innovation, combining a physician's clinical insight with 2 decades of experience leading advanced patient monitoring and AI-driven solutions across Europe and Asia. He began his career as a resident doctor at Badulla General Hospital in Sri Lanka, where he developed the early passion for improving patient outcomes through technology. Transitioning into healthcare informatics, he joined Philips Medical Systems in Singapore as a clinical specialist for Southeast and Asia regions, supporting patient monitoring, cardiography, and resuscitation systems across 6 countries. So Shandana's expertise deepened at Philips Bubliheim Center as an expert in Bubbling Center of Expertise in Germany, where he served as a senior product manager of IntelliView bedside patient monitors. So during this time, he spearheaded the development of guardrail early warning scoring solution, and embedded, and this is the crux of it, and which I told today I actually love. It's a beautiful solution. An embedded system designed to detect patient deterioration in general wards and alert nursing staff in real time. So just the extra note to that, usually they built robust early warning scoring solutions for ICU and high acuity units, but this is actually a solution for the general wards. It's a beautiful solution till today. This innovation became a crucial safeguard in hospitals where nurse to patient ratios were high, helping prevent avoidable ICU transfers and mortalities. Shandana's career advanced further when he assumed the role as head of clinical solutions and consulting at Ascom, based in Switzerland. There he built a three-pronged digital health strategy covering in-hospital clinical software, telemedicine, and corporate AI, protected to deliver strong year-on-year growth. Today, as a managing partner for healthcare at Arternes Global Consulting in Stuttgart, Shandana continues to shape health tech strategy for global clients, focusing on safe, scalable digital transformation guided by his stack principles, which stands for transparency, accountability, confidence, and control. Very strong. This will be actually, these principles will be tackled with our next session. So Dr. Shandana's career embodies the intersection of medicine, technology, and ethics. His lifelong commitment to designing systems that protect both patients and caregivers reflects his belief that the future of healthcare innovation must remain transparent, accountable, and profoundly human. I could not have said it better, and I firmly believe this as well. All right. So now I know there's a lot of words coming from my mouth, so sorry. But we have to acknowledge the amazing speakers that we have today. So I'm almost done. So next up is Dr. Gary Ang, and he is a clinical advisor currently at NHG Health. And he is also located in Singapore, and it's already night, late in the night with him. So thank you so much for being here, Dr. Gary. So Dr. Gary is a multidisciplinary public health physician and educator working at the intersection of healthcare, technology, and policy, trained in medicine, public health, and business. What a very good strategy to have. With further specialization in family medicine, mental health, and dermatology, he brings a unique, integrative perceptive to health systems innovation. He currently serves at Singapore's National Healthcare Group as a health services researcher, a clinical AI advisor, workplace health consultant, and family physician. In addition, he coordinates and lectures in the Masters of Health Economics, Management and Policy program at Newcastle, Australia Institute of Higher Education. Wow. Dr. Gary's work center on the ethics and equitable adoption of AI in healthcare, improving population health outcomes, and fostering human-centered systems in thinking, whether through data, policy, or patient care. His mission is to help health systems thinking clearly, care deeply, and evolve responsibly. Love it. Beyond medicine, he is certified bridge teacher and life master with the American Contract Bridge League, where he continues to pursue strategy, playing, and lifelong learning. Beautiful. Okay, and now the very last speaker, last but not the least, is Charles Barton. So Charles is based in Munich, Germany. He's a senior director of products, technology product portfolio at EGEM. I hope I'm saying it right. A visionary product and technology executive with over 20 years of experience scaling global businesses and driving AI-powered transformation across e-commerce, telco, fintech, health tech, and software as a service. He has delivered over $500 million in annual recurring revenue and achieved more than 60% year-over-year growth by building customer-centric platforms and leading high-performing global organizations. He has led large-scale digital transformation initiatives for global enterprises across retail, automotive, consumer goods, and technology, delivering measurable outcomes such as tripling e-commerce GMV to 10 billion euros and creating ecosystems that serves over 7 million users worldwide. I should definitely get you on board with us, Charles, at Protocare, because we haven't scaled yet. So I might just tap into that knowledge of yours. Okay, so that's the lot. That's the speakers. So thank you so much for joining us, all the speakers. All of you are amazing. So let's dive into the questions. And let me just give a little bit of an oversight to the viewers or to the actual attendees, participants that's attending our session today. So what we're going to do, since this is a question that every single person is asking, how should AI be implemented in health tech? Can it just be used as a plug-in and a play? So we're going to dive a little bit into that. But so I'm going to take you through a flow, sort of like a journey, that we bring all the voices of the speakers to light and get their answers. So first and foremost, we're going to dive into from early innovation to human-centered AI. So that will be sort of like a dual discussion between Michael and Dr. Shandana. And the core focus there is going to be how early predictive systems shaped um, today's Gen AI thinking, bridging design, frontline adoption, and trust. Explores lessons from implementation, clinician engagement, and why AI must support, not replace, human judgment. Sorry. So we will start with that. Then we will move on to the aspect of patient safety, ethics, and system trust. This will be handled by Dr. Gary. And here the core focus is we want to give you framework that safeguard patients while enabling responsible AI adoption, transparency, accountability, and equitable access. And then last but not the least, sorry, Josh, you're last again. We're going to dive into product design, interoperability, and preventative health. And then the core focus there will be building AI-powered products that connect fitness, wellness, and healthcare into one preventative ecosystem, focusing on interoperability, personalization, and data trust. So I don't know about you. I spoke a lot, so I think I'm going to start off, and then we will take you through that. So the aim of this flow is actually to help you with understanding policy, marry that to products, bring in the practice of it all, and then and lastly, but not the least uh, important, is patient impact and how it will impact the patients. Okay, so let's start off with our very first speaker, which is going to be Michael. Michael, you feel ready?
Let's go for it.
Okay, good stuff. So here we're going to tackle the reality of building AI in healthcare. So, Michael, you led projects that predated AI, yet embodied its principles: proactive data use, pattern recognition, and early intervention. But there's a common misconception that AI can simply be plugged in and start solving problems. Even us, as I said, we have people that ask us this with our NIS AI in Praticare. So now, Michael, from your perspective, what do people misunderstand about building Gen AI versus RAG? And of course, RAG is retrieval augmented generation systems. And what does it really take to make AI that healthcare workers can trust?
Yeah, so I think the biggest misconception or the biggest mistake that I see, particularly also startups or new companies new to this predictive business or solution development and deployment, is that they believe AI is a product. Every startup needs an AI tech and sell this as a product, but because it's not. It's the same with what you were part of the early predictive solution in the clinic informatics. It's actually it's a process. That's the first thing that people need to understand, that it's not just a product like any other. It's it requires a lot. So, but what is similar between what we have done in the past with predictive solution, the clinic informatics, and the nowadays same kind of AI solutions, is that the principles haven't changed. So the only thing that has actually changed is the speed. So the speed to innovate, that's a major difference that I currently see. But both approaches, they try to tackle a general problem in the healthcare space, which is clinicians are overwhelmed with the data. And turn this data into something meaningful and actionable clinical intelligence, right? That's the problem that both solutions, the early predictive and the upcoming AI solutions, try to solve and help basically to relieve the burdens from the clinicians to deal with that. So this is still the same. So, and you mentioned it also at the beginning in the intro. So when we are at Philips developed in the field a patient status dashboard and a clinical informatics solutions, what we basically were doing is that we are enabling the clinicians to compress and view complex data, patient data that was scattered across multiple flow sheets and notes forms into a very concise, compressed visual status icon view, where clinicians were very quickly could identify and prioritize if that is a patient that they had to dig deeper into the flow sheets or the notes. But basically, it gave them the context of the overall status of the patient and the organs, for example. And then they were basically deciding what to do. So at the end, what it addressed, it gave them the relief of the cognitive overload, basically. It was not automation, to be very clear here. It was just giving them the choice, right? So, and as I mentioned, AI can accelerate the process. And I have seen that myself with, you heard the buzzwords, vibe coding. It definitely can help you in the prototyping phase. So it can help you to improve and accelerate the prototyping. So the idea, you have an idea to the prototype. But the fundamentals are still the same. You need to understand the clinical pain points and translate that into requirements and integrate that into workflows immediately. So the critical point here is do not confuse speed with readiness, right? You end up in chaos. So, and when team talks about plug and play AI, they are skipping the real hard part, which are actually 4 points. It's like regulatory clearance, alignment, data governance, workflow integration, and project and change management. So you have to really be conscious of that and tackle these 4 areas. So we talk about regulatory alignment and clearances. And I'm taking the FDA as an example because that's the biggest market and they are shaping often also the market. So FDA cares not at all how sophisticated your AI algorithm or machine learning solution looks like. What they care has nothing changed. It's that you have to demonstrate that your solution is safe, effective, and it shows traceability across the entire product lifecycle. That is their guiding principle. Nothing has changed. So this is just recently in August, they released a new guidance called Predetermined Change Control Plan, which will be very important, or is important, which is basically a pathway for continuous improvement for AI systems post-market release. So this is the guidance, and there you have to follow a few major steps to successfully launch and clear a product, AI product in particular. So you have to show what will change in your AI solution. How is it validated after the launch and clearance? How do you mitigate risk? And that really important that whatever the AI solution is doing has to remain in the original intended use. If it's changing the intended use, you have to resubmit. But it's a big change in how the FDA approaches those solutions. So they have listened, they have adapted, and give you a guidance and a framework for that. But what the FDA also will do, they will scrutinize the bias of algorithms, as we know, right? Because algorithms, race, gender, there were a couple of examples in the past and where this was a problem. So they will look into that, the bias and how to mitigate the bias of AI algorithms is really a core focus of them. And they recommend, and that's the positive piece of it, because a lot of people think of the FDA as something, they are very scary and so on. But they offer a process called QSAP. So whenever you have an AI and you have a strategy of how to automate improvements, you should contact them through this process, and they will give you guidance for the PCCP, the predetermined change control plan. So that's really important. Then the other piece is the data governance. RAG systems can surface knowledge, right? But if knowledge isn't validated, traceable, or integrated into decision workflows, it's just noise. So that's don't think that RAG is the solution to everything. There's more behind it. It's a process. So workflow integration. So this is also really critical. So you have to respect this, the clinical workflow. This is a real differentiator. If your system doesn't fit how clinicians make decisions, it will get silent. So build it into the process, not on top of it, right? So, and then ultimately the project and change control or change management is so your team, R&D, quality, clinical, regulatory, they cannot operate in silos. They have to work together, collaborative as a team. So they have to align on the requirements. And GenAI can help you with documentation and prototyping, but it cannot fix broken implementation or deployment and development disciplines. So that's also really critical. So, and to summarize everything, so when people say AI is plug and play, this is what they are missing, right? Mm-hmm. You cannot drop an algorithm into a medical workflow and then think it's working. Yeah? And treat AI, whatever AI solution, GenAI or for process optimization, or then also RAG, like any other classified medical product, documentation, control system, validation, the list is long. So that's basically my take to this question.
Thank you for that, Michael. Very well answered. Thank you so much. So let's move on. So remember, audience, if you have any questions in between, you're more than welcome to drop it to us. I did see there was actually a question. Someone asked, what is the R in RAG standing for? So it's actually retrieval augmented generation. So that is what the what the acronym is standing for. Okay, so it's the R in RAG is actually standing for retrieval. All right. Okay, so now next up, Shandana. So, Dr. Shandana, from your perspective as a clinician, how do you feel when people talk about embedding commercial Gen AI applications into healthcare? Would it make sense to connect clinical data into a commercial Gen AI and ask it to solve problems?
Well, Halloween is around the corner, and this is the kind of question that really scares me, because, like Michael said, when we use a tool, we need to make sure that it fits within the process and that the process is really well thought out. And things can go horribly wrong if you do not think through the process through. So let me just give you an example outside of healthcare. If you've been reading stuff on LinkedIn recently, you would have seen the news that one of the big 4 consulting companies, I won't name who it was, having to refund the Australian government because of inaccuracies in a report which was generated by a commercial Gen AI system. So they used a commercial Gen AI system and no one really checked the report, and it had references to publications that really didn't exist. So this is what happens when you plug and play AI into processes without understanding the potential impact and without putting in risk management into that. So fortunately, in this case, no lives were lost because this was not healthcare. Now let's think about a clinical setting. Let's say I'm a radiologist. I'm looking at a PET CT scan, and I dictate into my speech recognition system metastatic lesions in the ilium. So ilium is a large bone in the pelvis. So now we have just plugged in a commercial GenAI system to take these few sentences that I dictate and turn it into a multi-page report, right? So unfortunately, my speech recognition system makes a very common mistake that is pretty common in radiology. It takes the word ilium and transcribes it as ileum. So ileum is a part of the small intestine. So what happens is, if I don't detect this error in time, the GenAI system will take this error and it will write a very convincing report on why this scan actually shows metastasis in the ileum and not in the ilium.
Sure.
Because GenAI systems are actually designed to generate things given your prompt. If you give the wrong prompt, it will generate something wrong. And this is a problem, and this is going to cost lives. So that means when we are actually embedding a tool in a workflow, we need to clearly identify, I mean, we can't just do it just because we are going to use AI, right? We need to identify which problem we are going to fix. We need to deliver a clear advantage over the way we do things today. Otherwise, we are just adding operational overhead into an existing process. And we need to have a thorough risk analysis done. Without that risk analysis, we run into all sorts of situations where it can, in healthcare, it can risk the patient's lives. So, and every stakeholder who's involved in this process needs to be trained. They need to be made aware of those risks that we have identified and how to mitigate those risks. So just plug and play in healthcare is a very risky gamble, and it can cost lives.
Absolutely. Thank you for that, Dr. Shandana. I can easily see how abbreviations in medicine can also cause that. There's such a lot of abbreviations, and some hospitals and clinicians are making use of them. So imagine you're actually looking for, you typing in an abbreviation and you want a conclusion on that, and it gives you a complete wrong algorithm of what it should be. So very true. So thank you so much for that. And really to take note of, at the end of the day, it's a patient that will suffer the consequences. All right. So now on to the next topic, which is why predictive systems fail and how to break the pattern. So this one is very dear to me, and I address this one to Michael. So since we know that ultimately it's up to the end user, the frontline nurse, the doctor, the physio, the OT, the technicians that's handling the respiratory systems of the patient, whether the system succeeds or fail, we've seen a troubling pattern of predictive systems being deactivated or silenced after go live. And I actually saw this myself in practice. This actually happened in 2009. It was a sepsis program that actually was launched. I was fortunate enough to do the trial at a hospital actually in South Africa. And according to me, because I'm a registered nurse, I thought by myself, oh my goodness, this is amazing. Imagine I had that when I was a nurse, meaning to say a solution that actually having my back, and it alerts me when a patient is prone to have infection and to prevent sepsis or septic shock. And I loved it. And when I did the trial with the nurses, working with them day and night in an ICU environment, I really saw the change. But there was one thing that occurred every single morning when I was back with the day shift. The night nurses deactivated the project and the program. They deactivated it. So now And that was a concern for me. Of course, we got better years later in how to actually make sure that the solutions do not get deactivated. But now my question to Michael is, so Michael, coming from a background where innovation begin in a field, not the boardroom, what lessons can today's AI developers learn? And how can Gen AI and RAG finally breach that trust between intelligent systems and, most importantly, human acceptance?
Yeah, so I'm going to, build on what you and Chandanda also mentioned. So why do predictive AI system get silent? And there's one particular reason. They create more work than they eliminate. So it's human nature, right? So if you have to do more on your already very busy schedule as a nurse or as a doctor or physician, you won't do it. There's no value, right? So, and I've seen that multiple times with different solutions that we rolled out during my days at Philips, but also later on, that predictive systems were launched with a big bang. You brought a cake to the customer, you had fun, celebrating the launch. And within weeks, when you came back, alarm fatigue or notification fatigue set in. And clinicians ignored the notification. And as you said, Susanna, they just turned it off. And within months, the whole system is basically dead. It's not used anymore. And the root cause is not always the technology. That's also important to know. And you mentioned it also. You were very excited to see that. It has to do also with poor implementation, deployment, also development. So implementation is also important. And I can give you a real example of when I was at that time, many years ago at Philips, and there was a marketing manager responsible for the international launch in supporting the regions for a premium patient monitor at the bedside. And we introduced a predictive sepsis protocol and bundle that basically, in theory, would change the world, because it could flag you within hours, or could flag you with a patient that within hours would potentially face a sepsis. So, and then you could switch into the bundle, and it gives you guidance, the whole thing that was at that time very prominent in the Surviving Sepsis campaign. And we basically integrated that into our bedside monitor. So technically brilliant. I still remember I got so super excited about this that I developed my own sales tool to show to the lives that you would save and the costs that you could reduce. But at the end, we were hit by the clinical reality. Why? When you looked at this, why they turned it off is because this integration had a problem that you had to manually key in the white blood cell count. So, and you can imagine in a busy ICU environment, they were running around, and then on top of it, they had to look for lab values and key it in. So that was not working. That broke their clinical workflow. Right? So transferring a paper-based solution protocol that also was supported by real clinical controlled studies was not working. So the key lessons learned is that put always the patient and the clinician in the center of what you develop and not just the technology. So how do you then actually innovate successfully that clinicians adopt and use? So as you mentioned, I'm a strong believer in innovating in the field, and coming back to the patient status dashboard that we developed at that time, is we did it by watching, observing nurses and physicians, how they work, what their issues were, for example, in their ICU rounds. We tested ideas and real workflows in the ICU and in the real world. We build prototypes directly in the clinical setting together with the clinician. So the proximity was relevant from day one. So we didn't enforce something on that. So, and today, the difference to today is that see that a lot of AI teams, they skip this step when they develop something, right? They build an AI model detached from the context and just think it's going to work. So don't make the same mistake. And I've seen it recently. I attended also an event here in Boston with GenAI and healthcare, and there was a company with speech to text and entity attraction from an EMR and generate very flashy, cool-looking doctor's letter within seconds, impressive speed, beautiful interface. I have to admit, right? But what was lacking? No human oversight building, no validation step, no reference to data source or age of the data. So operationally completely useless, because how do you know as a clinician, and you mentioned it, that the data is valid, right? So the lessons learned is that observation beats assumption. So that's my take. So and basically, how can RAG break the cycle? So there's according to the Philips Health Future Index, there's still a lot of uncertainty, but also hope that 63% of healthcare professionals think that they're very optimistic about AI, but 48% of patients do not share the same optimism, right? So there's still a big gap. So RAG has basically technical capability to bridge the trust gap, but capability isn't adoption. So you need to have frameworks like the TAC, transparency, accountability, confidence, and control, to make RAG successful. This implementation is foundational, so it's not optional. If you don't embrace this, even RAG is not going to be the solution to the problem, right? So if clinicians don't understand what data AI uses, they won't trust it. If clinicians don't trust the system, neither will patients, right? So in basically to come to the end, so to summarize, 4 essentials you have to look at for successful solution development and deployment. Don't forget the deployment, right? Integrate AI into your workflows, co-design with clinicians, design the workflow from the start, and build feedback loops that matter. So AI must learn from clinical overrides and corrections. So, and the adaptive algorithms need continuous validation. This also, as you heard earlier from me, is a requirement from the FDA in the PCCP, the Predetermined Control Change Plan. And then third, data governance. Yeah. So if the data is not clean, traceable, or validated, forget it. Garbage in, garbage out, right? We see that. And then fourth is a cross-functional alignment. You need to have a team that has to agree on requirements, risk management, validation criteria. And then ultimately the deployment is the change and project management piece. So clinicians won't adopt a system they don't understand or trust. So you have to introduce this into your clinical workflow and intensive training, planning, hand-holding. You must go into the clinical settings and apply basic change management principle, because it's such a game changer. So in all together, if your organization is ready to manage the operational discipline, so AI solution development and deployment requirements, you're not ready to deploy AI. So fix the foundation first. Nothing has changed, then build the intelligent layer. So that's, if you take this away from my session, I'm happy about that.
Beautifully said. And I agree with you. Thank you so much, Michael. Definitely build the trust of the clinicians, because they will be the ones to actually use it, and build patient advocacy around that. Beautifully said. Thank you so much, Michael. Okay, on to the next topic, which is balancing automation and empathy in healthcare. So I think we should answer it to have it coverage. So for the speakers, be cautious of the time going forward. I have heard that we can run over a little bit, but my next question, so just given consideration time aspects. Okay, Shandana. So, Dr. Shandana, in your opinion, how can healthcare strike the balance between automation and empathy, between letting AI assist and keeping the clinician's intuition at the heart of care?
That's a very good question. So when a patient enters the health system, they're implicitly trusting the clinician to be responsible for their well-being, right? And clinicians actually carry that ultimate responsibility for the patients that are under their care. And as clinicians, we also take an oath not to cause harm. So everything that happens to my patient needs to go through me. And of course, in clinical practice, we do delegate that responsibility, but we delegate it to those who we trust, right? And that means um, if I'm delegating the care of a patient to an intern, I will make sure that anything that the intern does to that patient is cleared with me, right? Until I learn to implicitly trust that intern. So it's the same when it comes to an AI intern. That trust needs to be earned. As a clinician, I'm
Absolutely.
accountable for the patient's outcome, right? So if AI is involved in patient care, I need to be informed every step of the way and be able to understand why those steps are being taken and be able to override the AI at any given time. Because no clinician wants to be in the back seat while the AI is driving. So if you attempt that, it will be met with pushbacks and the implementation will fail, not because of the technology, but because we put the patients first. And you mentioned clinical intuition. It's interesting because, like many AI algorithms, intuition is something that can be easily explained. It comes with experience. It's a subtle processing that happens in the back of our consciousness, which can't be explained with logic. But if you look at neural networks, this is exactly how neural networks work, right? I mean, they process data in a way that cannot be logically explained. And you cannot say this is because of A and it leads to B and because of C. It's a different type of statistical analysis that happens in the background. The thing is, I trust my intuition because it comes from me. It would be hard for me to trust the intuition of an AI system if it cannot explain itself to me. So that means through my experience, it needs to earn my trust. So I was looking at different ways in which we trust autonomous systems, especially things like, autonomous driving systems and so on. And this was the background to the TAC framework, creating the four pillars: transparency, accountability, confidence, and control. And these are the main pillars that we need to embed in AI systems in order to win the clinician trust. And that would basically ensure that the system is not turned off, that there will be no pushback, and that it's built in such a way that the clinician will learn to trust it. But we'll talk more about that in a follow-up session because it's a deep topic.
Thank you so much, Dr. Shandana. And yes, that's true. So the tag principles of Dr. Shandana will be discussed with the follow-up session. We will still announce the date. And now on to so thank you for the DO, Dr. Shandana and Michael. So now we're going to move on to Dr. Ang or Dr. Gary. And we are discussing the topic patient safety and trust. So Dr. Gary, you operate at the intersection of clinical care, public health, and AI. When you think of combining Gen AI and RAG in healthcare, what is the single most important condition that must be in place to ensure patient safety and trust?
And most importantly is accountability. So that there's a difference between accountability and being responsible. So accountability means you actually do more than that. You need to own the solution as well as the problem. So in my opinion, I think accountability is very important. And as doctors, as caregivers, as the providers, they're all accountable to the patient. The patient is the center of our needs. And that's the reason why if you want to use Gen AI, you want to use any of the predictive model, you must make sure that at the end of the day, it protects the patient safety, that you don't overly rely on it. So there's also some talks that you need to have a AI-free day sometimes to ensure that doctors will be skilled. This is still something that's quite controversial because right now currently a lot of doctors, especially for those who are using AI-assisted endoscopy, they may have lost the ability to detect lesions without the use of AI. So there are some of things that are off my head, yeah, about accountability.
All right. Thank you
Yeah,
so much for that, Dr. Gary. You still busy with that answer? Sorry, there was a drop.
sorry?
You done with that answer?
Yeah,
Okay,
accountability, yeah.
perfect. Okay, thank you so much. Still with Dr. Gary. So, Dr. Gary, from your experience, and this is now more sort of like personalization versus risk. So, from your experience with healthcare innovation and health systems, how can Gen AI and RAG improve personalized care without exacerbating risk of bias, privacy violations, or inequity?
Yeah, a key challenge is that what is the AI supposed to do? So, in my kind of work, you want to actually increase, let's say, for example, patient adherence to certain protocol, certain medication and compliance. So, in that case, the message is to take a medication. So now you can use AI to create the style. So my research is into using MBTI, which is a type of personality, as well as actually what is more broader is the psychographic profiling of patients. So Facebook, Instagram, they use quite often. So what they do is they know about your beliefs, they know about your values, so they will actually push this to you, and therefore based on what you like or not, they actually have a rough idea of who you are, so they can actually push out targeted personalized messages, advertisement to you. So this is some of the things we need to avoid in healthcare because we don't want to really overuse it so that we don't want to kind of like create this thing called echo chamber where the patients get their, for example, delusions being validated. That's actually quite dangerous. So we want to actually make sure that patients are nudged to do the right thing, but at the same time we don't overly control their behavior, and we're not trying to manipulate them to do certain things that is not ethical. So there are some of things offhand I'm thinking of. So in my piece of work, we're trying to see whether we can create different type of messages and see whether the patients will respond to them and change their behavior based on messages. And based on this, we will actually further improve our system so that we can actually achieve higher compliance as well as adherence. Yeah.
Okay, thank you for that. We're almost done. Now moving on to the future of Gen AI and RAG in healthcare. So, Dr. Gary, looking ahead, what is one bold application of Gen AI and RAG in healthcare that you believe is under-recognized today? And what must organizations start doing now to prepare for it, technically, culturally, and operationally?
Personally, my focus is on patient education. So in Singapore, we have different risks for the different type of use cases. Diagnosis is considered as high risk because it's actually direct patient care. Administrative work, you may affect some of the patients. So what is actually missing is actually patient education, where something I think is important because you're understanding why you will actually do the things you're supposed to do. So you need to know why you're going for the procedure, you know why you're going to take a medication, and what is the impact if you don't take it. So I think that's thing that's under overlooked. The challenge is that no one really pay for patient education. So that's actually something that we can still build on. It may not always be for money. It can be for purpose, for mission. So we can get funding from the philanthropy organization. We can get funding from government. So there are actually alternative source of funding. So coming back, I think what I think overlooked is actually patient education. How can use AI to help patients take better care of their health as well as navigate. For example, for patients going for health screening, there are so many different types of tests, cancer screening. Are they really for them? So without knowing your own risk, without knowing the risk benefit for all these tests, you may end up overdoing or worse still underdoing and then miss conditions. Yeah.
Okay. Thank you so much. Okay. Now we're moving on to Charles. I'm so sorry, Charles. You are mentioned every time to the latter, but whatever you do, I'm quite inquisitive in what your answers is going to be. And whatever you do, give me good insight in regards to um, having that beautiful set of annual recurring revenue. Since we are pre-scale, I would love to hear more about that.
Sure.
But let's not get off topic. So the next thing that you're going to discuss is product innovation and design foundations. So Charles, as someone who has driven product innovation and strategy across tech environments, how do you see the combination of Gen AI and retrieval augmented generation, unlocking smarter healthcare services, and what product design principles is most critical to get it right from day one?
Yes, thanks, Suzette. Great question. And before I jump into talking about the design principle, which is quite important and not very different from what the technology side of companies today are focusing on when building the authentic, I would say, AI and RAG systems is yeah. Before getting into that, just want to share quick context. As I'm representing EGIM, and we are taking a completely different approach to healthcare by going into the direction of preventive healthcare, where we believe that by living a healthy and active lifestyle, you can actually prevent 25% of health problems, and we're particularly targeting musculoskeletal and cardiovascular side of the equation. And the WHO health data tells us today that we have around 20 to 25% of the world's population today, which which is almost close to 2 billion people who are actually affecting with musculoskeletal and cardiovascular issues, right? And these are issues that are not necessarily biological or genetic. A lot of those issues actually happen because of lifestyle choices, right? So the direction we are taking is, can we actually create active and preventive, healthcare solutions by creating lifestyle choices where you don't actually go and check the condition of your heart and only realize that something is wrong with your muscles, right? After something has happened, but actually we make it a daily thing, right? Because keeping something in check daily is much easier to fix something where a problem happens months later, right? Almost 80% of healthcare problems actually happen because you realize much later down the line, right? So we are taking a consumer perspective towards it, and going towards healthcare professionals and clinicians as a result of building these solutions, validating it primarily on the consumer side first. And actually, a lot of Gen AI companies, starting with OpenAI themselves, for example, are actually taking that direction where they want to create awareness and also make a lot of healthcare data available directly in the hands of consumers, right? So going back to the question, the design principle, one of the important design principles that we are using is exactly on the direction of creating holistic health data, right? What we find, one of the reasons you cannot use, as Michael and Shanana were also saying earlier, we cannot rely on AI and healthcare systems, at least as of today, is because a lot of data is siloed, right? You don't have holistic profile of patients in healthcare systems where you understand the entire history, the entire set of problems, health issues over the entire, head to toe, and no single clinician or healthcare professional knows the end to end, body data of or the health data of an individual, right? So building holistic health data as one of the design principles is something that we are using, that we want to actually capture all aspects of health, right? And as we're focusing on active health, we're looking at sleep, nutrition, physical health, mental health, Yeah, and early diagnosis of, as I said, musculoskeletal problems and cardiovascular problems. So we've got a lot of metrics that can measure data, which is very specific, right? So, for example, in our system, we have data about how much body fat I have on my right arm and on my left arm, and how much body water percentage I have on my, specific areas of my body and things like that. And once you have very specific data, and that you basically spread that out to all cover all aspects of your body and health and so on, now is when you can use the power of AI to actually look at predictive capabilities over time, right? It will not be on day one, but and along with not just having individuals data, you also need capabilities, and as Michael said, validation, right? Very important, because you don't, even with the technology being capable, you still want to have human oversight, right? So holistic data combined with human oversight, predictability of AI getting better and better over time. It's not on day one. I think these are some important principles which can help us bring great solutions in the near future.
Absolutely. Thank you so much for that. So audience, just hang on a little bit. We have still two more questions for Charles. I hope that we are allowed to go a little bit over still, but the conversation is so amazing. And Charles, I'm taking notes actually from you, tapping on that holistic approach. And that's actually what we do with Protocare. We're really trying to put the health back in the patient's hands, and doing the wellness checks on a daily basis, and how we're going to integrate that data and bringing it to a holistic front. So yes, thank you. That was a beautiful answer. All right. So next on reaching prototype and real world deployment. So Charles, in your experience, since you have helped scaled products, and you have experience in it, you likely seen the gap between prototype and real world deployment.
Yeah.
So when we talk about Gen AI in healthcare, what's the biggest product or operation risk that often gets overlooked, and how should teams address it early?
Right.
I'm asking for
Absolutely.
myself as well.
Yeah, I think what is fundamentally different now with Gen AI systems is what we call, when we design machines and devices for healthcare, and and in our cases we also build them for fitness and physiotherapy uses. Um, they were ideally in the past built for what we'd call deterministic behavior, right? Where you know that the machine is going to get a certain set of inputs and it's going to provide a set of outputs, because those things are almost programmed into it, right? The set of data was programmed. Now with AI, we're getting into what we call undeterministic systems, where actually AI and RAG together can actually use data almost in real time, right? You can provide a report coming out of an MRI scan in real time, and you can get diagnosis results and predictions based on what problems and treatments and so on can happen, and all of that can also change based on the set of inputs. That if you provide set of inputs from the latest, let's say, study of cancer treatments, of course the results will be much more updated and so on. So when we look at what AI is capable of, now we get into the direction of undeterministic systems, and this is where we cannot just use the prototype in production, in reality. So this is where we have to scale this very carefully, very in a managed way. And the approach we are currently taking is we start with a much smaller set of use cases, right? Where the AI system is almost behaving like a predictive machine to start with, because the set of use cases are very small. And then over time, you increase the amount of use cases, right? So we have use cases that go into the direction of prediction and prescriptions at the moment, but those prescriptions are very limited. We intentionally decided not to start with, for example, injury use cases, right? Because when you do prescriptions in the case of injury use cases, in case we are still talking about health and fitness, what we do currently at eGym, we don't currently prescribe on what you need to do in order to For example, if it would be a rehab procedure in case of an injury, we don't treat those use cases because that require much more level of validation than creating a simple program for weight loss, for example, right? So yeah, so blowing up these use cases over time with a lot of validation as your AI system gets better and better, gets better data over time and gets better predictability is important. And also when we talk about scaling, it's also about looking at global scaling versus local, regional, and so on, right? So us as a company are present in 40 countries right now, but when we launch a system, we don't launch in all the 40 countries, right? This is very different from a machine. Like I know Philips Health very well. So Philips, for example, when they would launch, once it is proven in the studies, they probably would launch it globally, right? Because the machine will work the same way in any country where you launch it. But AI is not that the case because, for example, the demographic in Europe
True.
is very different from demographic from Asia. So the
True.
healthcare issues, we can't assume would exactly map. So AI systems are very different, and we have to be very careful about scaling in terms of demographic, countries, and the volume effects and so on as well.
Spot on. You are actually saying something that I haven't thought about because, of course, we're building for the South African market. I'm referring to Proticare now, and then we want to go globally. But what you have said about now, that's really true. Whether the country is ready for AI or not, you have to really determine what your next steps. Sure.
Yeah.
Solid answer. Thank you so much. Okay, last question. Charles, looking ahead 3 to 5 years from now, which use case for Gen AI and RAG in healthcare do you believe is under leveraged today? So whether in diagnostic, patient engagement, or operational efficiency, and what should product leaders begin building now to capture that value?
Yeah, I'll just connect the dots on what I already said and I think starting with holistic health data, right, bringing it all together is one of if you have to build a foundation of AI-based systems and AI actually helping, in healthcare and helping the professionals who are already there, we have to build the right foundation first, and the right foundation is this holistic health data, right? We have talked about EMR, systems in the past quite a lot, and AI is a super, scaled up version of that EMR systems that even today I think haven't reached the level that the vision in healthcare all this was to bring all the data together in one place, right? And AI needs to eventually get there, hopefully with interoperability, we will be able to do that, right? So I think one of the important aspects, again, foundation is not just data, it's interoperability for different vendors and providers in the solution space to be able to build systems so that they can exchange this data with one another, right? To bring all of that in one place. But I do believe the future will go towards more and more predictive, more and more and also prescriptive, right? That AI is able to prescribe, to sometimes
Interesting.
directly to the patient, to the consumer, right? AI will get powerful. I should not be saying that, but there are things that I can ask AI already before going to the doctor, and then I go to the doctor, and the doctor tells me exactly what the AI told me. So I'm
I
still
know.
validating it with the doctor. I'm not trusting the AI completely.
True.
But there will be a point of time where I would think, okay, these are things where I don't have to go to the doctor. Actually, eventually start trusting AI. Probably it's just a matter of time, I think. And when probably you said 3 to 5 years, I don't think it's going to take 3 to 5 years. But
Very
predictive,
true.
with the right data foundation, I think predictive healthcare and preventive, as I was saying earlier, is also the future.
Absolutely. Thank you so much for that. Every single speaker, you have been amazing. Should we do one question at least from the audience? Um, I don't know. Is there a question that stood out, Michael, Shandana, Dr. Gary, or Charles, that you have seen and that you want to answer?
I mean, most of them were like clarification about namings and, about RAG and the difference and the impact. But also there was one question on how can you set up your organization to be AI ready as a developer. And I gave in the chat the recommendation not to do another LinkedIn training. You need to have hands-on training. You need to dedicate time so that your team can experience the limitations, but also the possibilities, right? So everything that we said, because that's my recommendation to the audience, right?
I love that.
Invest in this.
Yes,
And
absolutely.
to add to that answer, I think one of the other things that need to be done is, let's say you're trying to address a specific question or a specific problem, and you need to identify which data you need potentially to solve that problem. And you need to make sure that when you're building your system that you have access to that data. And this is what Charles said that really is important. You need to ensure that you get that data through interoperability, through interfacing with multiple different systems. Because if you feel that a certain item of data is important, you need to have a way of getting it. And that's a pretty important step. So you train not only on building AI, but also on getting data.
Exactly. Yes, yes, yes. So thank you. Beautiful. I don't know whether the audience, someone still want to drop a question, but from my side, I want to conclude and say, thank you so much for all the speakers, Shandana, Dr. Shandana, Michael, Dr. Gary, and Charles. You have been amazing. I know that we're planning a next follow-up session where we're going to tackle the tag principles. And then I don't know whether Open Innovator Group want to mention this, but actually the next session, there will be startups that's going to pitch their solutions. And there is going to be surprises coming up with that with the next session. And I can easily see, because I got so much inspiration from the session, and from Michael, the time that I was with Michael in with the Center of Expertise team, he was actually my boss. So by the way, Michael was my boss. So in any case, so then we did a few hackathons. Now imagine, and this is what Charles said as well. You got to bring it. And not Charles, actually. This is what Michael said. You got to bring it. Don't just talk about it. You have to bring action across and hands-on skills. And imagine in this group for our third session, we can actually have a hackathon. That would be amazing. I would love that. But in any case, so just to conclude from my side, I had such an amazing session with all of you. And my real takeaway from today is that AI's greatest value lies in supporting human care, not replacing it. That's how I see it. So I hope this session offers valuable lessons or brought you valuable lessons and meaningful answers to your AI health tech questions. I really hope that all of you had a great session with all of us, and definitely we're going to check in with you again, follow up. If you have any questions, we will go through the questions again, and if there's a follow-up needed, we will respond. And look out for your LinkedIn posts. We are definitely going to announce another session. Thank you so much for your time. It was amazing spending time with you, and you all have been amazing. Thank you so much.
See you guys.
Thank you.
Thank you.
See you. Bye-bye. Bye, everyone.
Thank you. Bye-bye.
Thank you, everyone.
Bye.
Thank you. Wonderful session. Thank you. Thank you, Suzette.